All right. So I'm going to quickly, again, write drug, write dose, write route, write time. I need to check my medications 3 times before I give it. Probably as a nurse myself, my third check would be at the bedside, but you are required as a student to have checked them 3 times before you ask your clinical instructor to come and check them with you, so then you can take them to the bedside. So we'll say we're checking drugs 3 times here at the med cart. Write drug, write dose, write route, write time. And again, I'm kind of going a little more quickly than you might, but write drug, write dose, write route, write time. I look at each one, preparing them. Okay, I know I need to get my orange juice. Write drug, write dose, write route, write time. I can look at this one more time for my third time, and I've got it just ingrained in my memory by now. I'll lay that away. I don't need to give the milk of magnesia, and I have a suppository that the person has not requested yet. So I'm ready to go into the patient room. I want to secure my cart, so I'm going to be sure that I lock my cart. Maybe. I've locked my cart, close everything up. I want to secure any patient identifying information. If I have maybe a booklet, I would need to close it that has all the patient's MARs in it, so that no one that would be walking by might see any information. All right, so I am going to go into the patient room. I take my medications and my MAR. Okay, now once I'm in here, I want to identify my patient, and I don't say, "Are you Mr. Smith?" Certainly he might be hearing impaired. He's pleasant. He wants to get along. He says, "Oh yeah, what do you need?" So what I want to say to him is, "Can you tell me your name and your birth date?" He verbalizes his name and birth date while I, using my MAR, verify his patient information that is to be correct with his armband. I check his medical record number, date of birth, and his name. And then I'm going to open my medications. As I open them, again, I'm kind of doing a quick check. At this point, he may be telling me about his fishing trip with his grandson. I'm a bit distracted. It's not probably as accurate of a check, but boy, I've checked them 3 times at this point, and I know what's right. So I will open these up, drop them in this cup that contains the other open medication, and then I'm going to take the little packages and put them in my pocket so that I can do my documentation with them later. I have Nitroderm, I have Norgesics, and I open those up, drop them in the container. Bumix, open it, drop it in the container, and I might go ahead and prepare my Kalor at this time in the orange juice that I got from the kitchen before I came in the room. Have the Lipitor, and that's all. So he is very compliant. He's sitting upright. I want to have him sitting up as much as possible so he doesn't choke. He takes his medications. I would need to, if it were a person that maybe was swallowing impaired or maybe a little mentally impaired, I might need to check his mouth to see if he actually took them all. If he dropped one in the bed, it would be okay for him to pick it up and go ahead and take it. But certainly any medication that drops on the floor, it needs to be replaced with another one. Even if he says, "Oh, honey, that's all right," it don't matter. There is no 3-second rule. So he's taken all of his medications, I want to always kind of add some organization to this. If I had, let's say I have an eye ointment to give, I have some pills, and I have a topical, which I do have, I would certainly not want to do the eye ointment first, because then he wouldn't be able to see to take his medication. So I want to give him his pills, do the topical. No, excuse me, I want to do the eye ointment next, and then do the topical last. All right, so he's taking his meds. A few things about a topical is you want to make sure that you find the old patch, remove it, take a tissue, and wipe away the excess medication. If you don't, then the patient would be getting basically an overdose. So, and then I want to alternate sites. So I'm going to apply it to a clean, non-hairy area. On some drugs, you might date time and initial the patch, depending on what they are. This is and all topicals, you want to make sure that you're wearing gloves. This happens to be a vasodilator, and if you get it on you, it's going to cause you to have a headache and lower your blood pressure, so you want to be cautious with that. Some patches that you'll be applying will be a narcotics pain patch, and each hospital will have their own policy relating to that, the waste of the old patch. But know that you don't want to just remove a narcotic pain patch and throw it in the trash can. In some cases, you bring it back out, and you and another person will put it in the sharps container in order to waste it. But we try to cut down on any possible situations where someone might try to use the drug. Also, you have some people who say, some patients who say, oh, it's my back, it's really hurting me, please put that on my back. So, that's kind of a difficult place for the next person to find it, so you want to make sure that you are documenting the place that you've applied it, or also then passing it on in report so that the next person knows where to look for that pain patch. There's been cases where the patient, the old patch wasn't found, the patient was over-medicated, and actually ended up in ICU because of the over-medication with our pain patches. All right, eye ointments, certainly we need to remember that the eye is sterile. We don't want to touch the applicator itself, and we don't want to touch the applicator to the eye. We want to make a pocket on the patient at the lower lid and drop it down in there. So the patient needs to be in a reclining position, or at least sitting with their head tilted back. For some medications, you might need to apply pressure to the tear duct so that it doesn't go right down the tear duct. And with an eye ointment, again, we're making the pocket, and then we begin at the inner canthus and go towards the outer edge. And then give them a tissue or whatever as needed. All right. That's a bit about the different types of drugs. So we've finished in the room. I have all of these little packages in my pocket. Now, this one I probably would not put in my pocket because I don't want to take any chances of getting an ointment on me, so I've pitched it. But I certainly have that committed to memory by now. So I go back to the med cart, and I'm ready to do my documentation. I pull all my little packages out of my pocket, the ones that I have. Certainly I don't have all of them at this point. But you need to know that your documentation is as much of a deliberate step as giving the meds were. Again, I'm going to start at the top and work my way to the bottom. And I take my little package and I start out saying right drug, right dose, right route, right time. And then, I can't do it like that. Hold on. And then I'll initial it. Okay. And then I have the Transderm Nitro committed to my memory. I can see the big number 10 on there. And again, right drug, right dose, right route, and time. And I'll initial. And again, this is where I'm not just finding the 9 and going down there and writing. I'm checking and saying in my mind, did I give this? The Norgesic, yes, I put my initials there. If I had a drug that had required me to maybe check a pulse or do a blood pressure prior to administering it, and it would normally say, like maybe in this area, check pulse prior to administering, or a hold if less than 60, or hold if less than a certain parameter for blood pressure, then I would write my pulse or my blood pressure right beside my number and then put my initials on there. Okay, and if I had to give this medication 4 times, if this were a blood pressure med, I had to give it 4 times. Every time I would have a time, I would have a blood pressure next to it, and then my initials. So sometimes you do have to write small. Again, right drug, right dose, right route, right time. Right drug, right dose, right route, right time. And then at the bottom, you want to sign using your first initial, last name, title, and then put your initials on there. Your initials here says this is the person that's been doing this documentation up here. You guys as students then will have your instructor then to sign behind you.